The House Health Policy Committee will come to order. Would the clerk please read in the letter from Speaker Hall?
Dear Mr. Clerk, I appoint the following members of the 103rd Legislature to the following standing committees. Health Policy, Representatives Curtis Vanderwall, Chair, Jamie Thompson, Vice Chair, Luke Meerman, Mark Tisdale, Matt Bierlein, Nancy DeBoer, David Preston, Kathy Schmaltz, Alicia St. Germain, Carl Bonack, Steve Frisbee, Karen Whitsitt, Minority Vice Chair, Brenda Carter, Angela Whitwer, Cynthia Neely, Jason Hoskins, and Morgan Foreman. Sincerely, Matt Hall, Speaker of the House, 42nd District.
Would the clerk please take the attendance?
Chair Vanderwall.
Present.
Representatives Thompson,
Present.
Meerman, Tisdale,
Here.
Bierlein,
Here.
DeBoer,
Here.
Preston,
Here.
Schmaltz,
Here.
St. Germain,
Here.
Bonack,
Here.
Frisbee,
Here.
Whitsitt,
Here.
Carter,
Here.
Whitwer,
Here.
Neely,
Here.
Hoskins,
Here.
Foreman.
Here.
Mr. Chair, you have 16 members present. You do have a quorum.
Thank you, Madam Clerk. The Health Policy Committee will follow the Uniform Committee rules stated in Chapter 4 of the House Rules that were adopted on the House floor. I have a proposed committee rule I am offering. A copy is before you. Representative Thompson moves to adopt the rule. Will the clerk please call the roll?
Chair Vanderwall,
Yes.
Representatives Thompson,
Yes.
Meerman, Tisdale,
Yes.
Bierlein,
Yes.
DeBoer,
Yes.
Preston,
Yes.
Schmaltz,
Yes.
St. Germain,
Yes.
Bonack,
Yes.
Frisbee,
Yes.
Whitsitt,
Yes.
Carter,
Yes.
Whitwer,
Yes.
Neely,
Yes.
Hoskins, Foreman.
Yes.
Mr. Chair, you have 16 yeas, 0 nays, 0 pass. The motion prevails.
Thank you, Madam Clerk. Representative Tisdale moves to adopt Wednesdays at 9 a.m. in room 519 of the House Office Building as the normal day, time, and location for meetings of Health Policy Committee. Will the clerk please take the vote?
Chair Vanderwall,
Yes.
Representatives Thompson,
Yes.
Meerman, Tisdale,
Yes.
Bierlein,
Yes.
DeBoer,
Yes.
Preston,
Yes.
Schmaltz,
Yes.
St. Germain,
Yes.
Bonack,
Yes.
Frisbee,
Yes.
Whitsitt,
Yes.
Carter,
Yes.
Whitwer,
Yes.
Neely,
Yes.
Hoskins,
Yes.
Foreman.
Yes.
Mr. Chair, you have 16 yeas, 0 nays, 0 pass. The motion prevails.
Thank you, Madam Clerk. Just for a moment before we get started with our first bill that this committee will hear, I'd like to just take a moment to say thank you to both sides of the aisle here for being here. I look forward to a very busy year, but I'd like to have everybody have an opportunity to introduce themselves to the audience today. I am Representative Kurt Vanderwall. I serve the 102nd District, which is basically just north of Muskegon to just north of the city of Manistee. I've been fortunate enough to be in office starting my 8th year and look forward to a great committee and getting great things done together for the folks of the state of Michigan. And I will turn it over to Majority Vice Chair.
I'm Representative Jamie Thompson, and I represent Southern Wayne County and Northern Monroe County, with the majority of my district being the downriver communities. Beginning my second term in office, I was very excited to be appointed as vice chair. I am a nurse, and I also look forward to working with both sides of the aisle to get some good things done in health policy for our communities back home. So thank you.
Hi, Representative Mark Tisdale, 55th District, Rochester Hills, 1 precinct in Oakland Township that we never want to forget. This is my second time on health policy, 40 years experience in health-related sales.
Matthew Bierlein, 97th District, portions of Bay, Genesee, Saginaw, and Tuscola counties. Looking forward to working with all of you.
Nancy DeBoer, 86th District, which is the city of Highland and the townships around it. Really care about the health of the state and its children. So I'm thankful to be on this committee.
Dave Preston, 108th District, eastern side of the UP, extending from the Wisconsin border of Menominee to Dafter up by the Sault Ste. Marie. 3.5 hours in distance, longest drive out of all of our reps. And my background, I'm a licensed paramedic as well as firefighter. Been in EMS for almost 15 years. Also serve on the EMSCC committee. Thank you.
Kathy Schmaltz, I represent the 46th District, Jackson, Chelsea, and in between. It's my second time on the Health Policy Committee. I'm looking forward to working with everybody, especially to help our most vulnerable citizens, children, and seniors.
Good morning, Alicia St. Germain. I represent the 62nd District. That's Harrison Township, the south end of Chesterfield, north end of St. Clair Shores, a little bit of Roseville, Clinton Township, and all of Fraser. 62nd District is just about 25 minutes northeast of Detroit. I'm excited to be on the Health Committee. I've always been an advocate for health and fitness, and just curious to see what kind of good policies we can come up with here.
I'm Carl. In the in the central portion of the Upper Peninsula. I am again newly elected, and I'm really looking forward to working with all sides of the aisle on this crucial issue, health policy.
I'm Steve Frisbee, 44th District in Calhoun County. Includes the cities of Springfield, Battle Creek, and Albion, and 6 townships across the top of Calhoun County. I'm a retired paramedic after 41 years, 43 overall in EMS. So looking forward to bringing some of my experience to health policy. Thank you.
Hi, I'm Karen Whitsett, and I am the Democratic Vice Chair of the Health Committee. This is my 7th year on the Health Committee. Happy to serve. There are a lot of great things that we can do. I represent Detroit, which is also right directly at Dearborn, which I represented in the last term. And I'm just happy to be here. We've done some great things before, and I'm excited to see what we can do this term.
Good morning. I'm Brenda Carter. I represent Auburn Hills, Waterford, and the entire city of Pontiac. I'm the Minority Vice Chair of Insurance. I am also the National Chair of the National Council of Insurance Legislators. I serve on health policy there, and I'm also the Vice Chair of Banking, Financial Services, and Insurance for the National Council of State Legislators.
Morning, I'm Angela Whitwer. I represent the 76th District right outside of the Capitol. It's most of Eaton County, and I have been in healthcare for 22 years prior to me being here, and worked both on the clinical side and in administration. Look forward to working with you.
Good morning. I'm Cynthia Neely, and I represent the 70th District, which is the entire city of Flint, part of Burton, part of Flint Township, and part of Monday Township. And I've been on health policy. This will be my 5th year. I'm glad to serve, and I'm looking forward to working with everyone.
Thank you. Good morning, everybody. I'm Jason Hoskins, representing Michigan's 18th District, which covers the cities of Southfield, Farmington Hills, Lathrop Village, and Oak Park. Definitely looking forward to serving on this committee. Hospitals are my biggest employer in my district. Also have Corewell Health is headquartered in my district. So definitely looking forward to diving into the issues that are going to come forward in this committee.
Good morning. I'm Morgan Foreman. I represent Michigan's 33rd District, which is southern Washtenaw County. So parts of Ann Arbor, Pittsfield, Lodi, Bridgewater, and all of Saline. I am a graduate of the University of Michigan's Health Policy Fellowship through CHART. I learned a lot about health policy there, but I have a lot of experience navigating this as navigating the health system as a patient with a chronic illness and a caregiver for my 90-year-old grandmother. So that is why I am very excited to be here, and hopefully we can get some really good things done.
Well, thank you, everybody, for your introductions. And again, we look forward to being productive and look forward to doing really good things together. But, you know, with that, it's time to get to the real business of the committee. And next, we will be taking up our first bill, 32. We have Representative Linting here to give testimony on her bill. She will be joined by Adam Carlson from the Hospital Association, and then after they're done, we will be joined by Dr. Salome, who works at Trinity Health, will be joining us by Zoom. If the good representative could make her way up with Adam, we would appreciate it. Remember to put on your mics, and we will take questions right after your testimony if anybody has anything, and then we'll go right to the good doctor. Thank you. The floor is yours.
Good morning, and thank you, Chair Vanderwall, Vice Chair Thompson, and Minority Vice Chair Whitsett for providing me the opportunity to speak on behalf of House Bill 4032. House Bill 4032 eliminates the sunset on the Interstate Medical Licensure Compact. Without this legislation, the IMLC will expire March 28th of this year. The IMLC is an important interstate agreement between 40 states allowing expedited licensure for qualified physicians. The IMLC is needed for Michigan to address physician shortages, provide care to rural communities, and to avoid costly licensing procedures that could endanger access to medical providers. House Bill 4032 mirrors legislation previously passed by the House with 105 votes in a past session. Removing this sunset will ensure that Michigan remains in an important interstate agreement and is a state that can provide access to both affordable and quality health care. I'm happy to take any questions, and I thank the committee for its time.
Thank you, Representative. Thank you, Mr. Chair, members of the committee. We appreciate your consideration of this legislation. I think the representative did a great overview of it. I would just add that for rural areas, this is particularly important to extend this sunset so we can continue having access to care. And then just a note that as part of the compact, states are able to share disciplinary action and investigative information to make sure that we have, as everyone in the compact is a qualified provider. So happy to answer any questions, or we can turn it over to Dr. Salome to give some more info as well.
Any questions from the committee? Yep. Representative Carter?
Thank you, Mr. Chair. Have there been any issues with Michigan's participation in the compact?
Not to our knowledge. Michigan's been in the compact, as we mentioned, for several years now, and so this would just continue our participation with those other 40 states.
Thank you.
Representative Foreman?
Thank you. Thank you for your testimony. My question is, historically, the administration and department has had issues with compacts. Are there any issues with the department and the administration right now with this particular compact?
I would defer to the Department of Licensing and Regulatory Affairs. It's our understanding that they support this compact. The way this compact is structured, as I mentioned, each state still is able to share that investigatory information with each other, and so they're able to take appropriate action if necessary, and I know that's been a big concern for the Licensing and Regulatory Affairs Agency, but that's not an issue with this compact.
Seeing no other questions at this time, thank you both for being here. We will turn it over to the good doctor, Salome, who is on Zoom, I hope. Doctor, the floor is yours.
Thank you. Can you hear?
Yes, we can.
I apologize. I'm not sure if you could see my video. I had to use my phone today as my computer is not cooperating. Good morning, Mr. Chairman, members of the House Health Policy Committee. Thank you for this opportunity. I believe this is my third time testifying in support of this bill. I would also like the opportunity to thank sponsor Representative Linting for reintroducing this important legislation. My name is Dr. Mo Salome. I am the Chief Medical Officer for Trinity Health Michigan Medical Groups. Our service area includes the Metro Detroit area, Ann Arbor area. We have a significant presence in Southeast Michigan, Oakland County, Washtenaw County, and Wayne County, including several practices in rural locations. We also serve the Muskegon, Grand Rapids area and have a pretty significant practice in the Lakeshore area with 4 clinics designated as rural healthcare centers. In a previous life, I worked in the UP in Marquette and Escanaba in a similar role. And this compact, I believe, is vitally important for our ability to recruit high quality, talented individuals. And for these individuals, we're competing with several other states. The end point of why that's important as far as what the consumers and citizens of Michigan see is more streamlined process and licensing to allow us to bring more talent into the healthcare system to serve patients in need, particularly in rural, inner city kind of locales where sometimes recruitment can be challenging, and or the process to get licensed once application is done outside of prior to this compact being in place, just the lead time was so much higher, and sometimes that would scare away certain applicants who wanted to move and start on a specific date. At any given time, Trinity Health is caring for 10 to 15% of the population, whether it is within our physician offices or at the various hospitals across the region that we serve. We have 2,200 providers across that region, and continuing to grow. And with the demographic changes, with physician shortages and other provider shortages, I think keeping the compact in place beyond the sunset period is vital for that process. So happy to take any questions or any other thoughts folks have. Happy to address those as well.
Any questions from the committee? I don't see any questions, Doctor. I thank you very much for your time today and appreciate it very much.
Thank you so much.
You bet. With that, Representative Schmaltz moves to excuse absent members. There being no objection, the motion prevailed by unanimous consent. There being no further business before the committee, we will stand adjourned.